Hi guys, it's Scott from the clinical department here at EMSA, and I want to start a series of short videos. I really don't like recording myself, but I'm gonna do my best to put together some short, let's say between 5 and 7 minute videos that focus on using the ventilator. We recently had some training on the ventilator, and we covered a lot of stuff specifically about different conditions. And I thought that it would be best to put together short segments rather than the very long videos that we've used in the past, so that would help people understand different things about the ventilator, so we can get more confident collectively and be more effective. So I thought in this video I'll just talk about in general why you want to use the vent and some of the things that you can look forward to in the subsequent videos. Is first of all, consider how difficult it is using a BVM. If we're honest with ourselves, me as included as anyone else, using a BVM and trying to get a seal with a mask on someone's face. There's hair, beards and mustaches and things get out of the way or get in the way and make it to where they don't seal very good, and it's really difficult to get a good chest rise. That chest rise difficulty is partially due to not being able to create a good seal. Second to that, the lungs are collapsed. There's no pressure inside the lungs, and these lungs are made of pretty dense tissue, and also it's difficult when there's no airway pressure in there. Those lungs are going to collapse, and every time you give a ventilation with the BVM, you're trying to reopen those lungs. So instituting the use of the vent as early as possible in your care, the biggest advantage to this, it can be summarized with consistency. Consistency, oxygenation, and PEEP. I'll do a section just on PEEP, and we'll talk about that a little bit so that we can utilize that to its fullest extent and advantage. But when you use the ventilator, you're giving the same volume of breath every time. You're giving it at exactly the same moment in time with every breath. They're sequenced perfectly, and you can provide high concentrations of O2. And then, last but not least, PEEP. PEEP is important so that those lungs that are collapsing whenever you're using the BVM, and then you have to reinflate those lungs that are kind of sticking themselves together in atelectasis. If you can maintain PEEP and use two hands to hold a seal with the mask, if you can use the ventilator just as BVM with hooking the mask to the end of the tubing, throw in an oral or a nasal airway in the patient, and then hold that mask with two hands, now you can create a seal. You can use capno, and you can provide this patient some PEEP so their lungs don't collapse. So that's the most important thing in just getting ready, or orient yourself to where you know how to hook up the tubing. That's really not, the difficult thing. I like to remind people that although the filter doesn't come in the package for the ventilator tubing, a filter is absolutely an essential piece that protects the patient from any contaminants that may have, gotten, as far as dust, fungus, mold, whatever, have gotten into the port on the vent where the air comes out to give the ventilations in the tubing. So I know we keep a cap on it, but it doesn't mean it's sterile. So put that filter on between the tubing and the ventilator so that we protect our patients from blowing any kind of contaminants into their lungs. So I think it's important for us to get comfortable enough that we utilize the ventilator in the best possible way. In the later videos, I'll talk about setting tidal volume. I'm going to talk about titrating your respiratory rate. We'll talk about adjusting the IE ratio, titrating your concentration of oxygen that you're providing, and many other things that we'll talk about triggering, and hopefully get you a little bit more oriented. If you don't feel comfortable with the vent, get you to where you feel like you can utilize this, and we'll go stepwise through it together so that it makes the most sense. And really, this is just about practicing and getting it out and knowing where the settings are. And that's just a matter of turning it on and taking a look at it, and then trying to use it at every opportunity, knowing that if I get in trouble, it'll give me an alarm, and I can read the alarm and try to fix it, and we'll talk about how to fix some of those things. But I can always retreat back to the BVM momentarily until I can figure out what's wrong with it. But this vent is great because the alarms tell me what I need to be fixing, and so if I read that on the screen, then I can go and start working on it. You got three lights on the vent itself. It's got a green light, it's got a yellow, and it's got a red. Just obviously, if it's green, it's good to go and everything is fine. You can just tweak your settings or do whatever you need to do. If it's yellow, it's still going to provide ventilations, but it actually is not set up quite right, and you've got to move something. So we'll talk about some of the things that can happen there. And if it's red, you need to take it off because it's not providing ventilations, and it's going to make your patient get hypoxic very quickly. So if it turns red, you got to get it off and figure out what the problem is. So this will be the end of the first video. Stepwise, if you're going to use the vent between now and whenever I get something else out, utilize the vent as a BVM. Put the mask on the end of the tubing. It comes on with settings that are fairly appropriate for just about anybody, that you can tweak those settings. Put in an oral or nasal airway or both, and oxygenate your patients with that 3 to 5 of PEEP, 100% O2, a tidal volume of 500, and oxygenate them up before you start trying to put in an advanced airway. And whenever you get the vent to where you want to set it up for your tube, you're going to go through stepwise. You're going to go through and you're going to set up your tidal volume first. After you get your tidal volume set, you're going to set that based on what your PIP pressure is. After you set the tidal volume, you're going to set your respiratory rate. After you set the respiratory rate, you may have, turn up the FiO2 if you haven't already. And then we'll start looking at some more detailed settings. But that should get us started. So we'll talk to you guys in the next video.